Good evening, Rotarians. Welcome to the February Rotary Zone 33 Foundation Program. Tonight's theme is Creating Lasting Change. We have four speakers who will provide different perspectives on their experiences to make long-term enhancements in the lives of people around the world. Some rules for tonight's program. Please stay muted throughout the program. We have a question and answer session after each speaker. Type your questions into the Q&A, which should be found on the bottom of your screen to the right. Assistant Regional Rotary Foundation Coordinator Al DeLucia will be curating your questions. At the end, we'll open up to answer remaining questions. Our speakers this evening are Karina Ito, who was a Rotary Peace Scholar graduating from the Duke UNC Peace Center program in 2011. Karina is currently the Chief of Staff of the Community of National Committees at UNICEF. She is currently an alumni representative on the Duke UNC Peace Center Governing Board. Rotarian Jim and his wife Dawn Mortimer are members of the Rotary Foundation's Legacy Society. They will tell you their interesting story of why they are including the Rotary Foundation in their bequest. Assistant Regional Rotary Foundation Coordinator Geetha Jayaram will tell you about our experience making global grants more impactful and long-lasting. Unfortunately, tonight, Lloyd Navarro cannot be with us, but Ann Evans has graciously agreed to talk to us about a program in California. So let's get started. Our program with Peace Scholar Karina Ito from Brazil. Karina.
Thank you, Stephen. Hi, everyone. Such a pleasure to be here with you. Thank you so much for the invitation. When I was told about the theme of tonight's talk, creating lasting change, I thought, well, maybe I can tell them my story and how Rotary helped me get to where I am today, and maybe to where I want to be in the future. Who knows? Yes. So my story starts the year when I was born. It was 1980. That's when the first National Immunization Day in Brazil was organized. As you know, back in the 70s and the 80s, Brazil was in really bad shape in South America in general, with polio predominantly, especially in the poorer areas in the country. It was a plague. Yes, it was all over. So then I think due to a partnership of UNICEF, the Rotary Foundation, and the Brazilian government, the National Immunization Day started, and they were very, very successful. So my memory, my childhood memory of that of back then is of seeing Rotarians and UNICEF staff, UNICEF volunteers in every corner in front of supermarkets, schools, churches, everywhere to ensure that everybody was getting vaccinated. And this is a successful story because, as you know, in Brazil, polio got eradicated in the 90s, and in South America, it was in 94. But ever since that time, working for UNICEF when they became a dream. I ended up going to law school. Then I specialized in human rights, started working for a local school and volunteering at a local nonprofit that supports underprivileged children with cancer. That's when I first heard about the Rotary Peace Fellowship. It was through a Rotarian who was also a supporter of the same nonprofit. And she said, I think you have the profile. Have you heard of the Rotary Peace Fellowship? So I started researching about the program. And I thought, maybe I can give it a try. When I read the profile of the other Peace Fellows, I have to say I was overwhelmed because I thought to myself, I can never measure up, but I can try. Yes. So I applied twice. First time I applied, I didn't get in. Yes. But then I thought, I think this is worth giving another shot. And I have to confess that if I hadn't gotten in the second time, I think I would have tried again until I got in. But second time, uh, I got in thanks to the then director of the Duke UNC Rotary Peace Center, Susan Carroll. You remember that back in 2008 and 2009, the world was going through some rough patches financially, and the foundation had decided that year that alternates wouldn't get in, even if anybody, anyone who had got the scholarship and got the ladder first had declined acceptance to the program. But I think thanks to Susan, who interfered with the Rotary Foundation, I ended up getting in. I was an alternate, yes. So I chose to go to the political science school. I entered the political science program, international relations and comparative politics. I entered the PhD program at UNC Chapel Hill. And then, and I also got a certificate in peace and conflict resolution. Yes. So during my time at UNC, as you know, part of the program is that you have to choose an applied field experience. It's an internship right in the middle of the program. And I interned in two different places. The first one was ICMAC, that's an International Center for Missing and Exploited Children. In the United States, you have NICMAC. They manage the Amber Alert, for those of you who may be familiar with the Amber Alert. And then I interned at UNICEF headquarters in Geneva, both in the area of child protection. After I graduated, I had the opportunity to serve in the United States with an OPT. That's a visa that allows you to work in the country for another year in the area of your studies. And that's what I did. So I ended up getting an internship at UNICEF USA. It was through another organization called Atlas Corps. And at UNICEF USA, that internship turned into a job. Yes. And I've been working for different UNICEFs around the world. It's UNICEF USA, UNICEF Australia, UNICEF Netherlands, UNICEF Canada, you name it. Today I serve as the chief of staff of the community of national committees for UNICEF. When you hear about UNICEF USA, UNICEF Japan, or UNICEF office in a high-income country, that's us. We coordinate 32 UNICEF national committees in high-income countries, and we are our work is to do resource mobilization and advocacy for children, and it's an honor to serve in this role. Yes. Going back to the theme of today's talk, creating lasting change. I thought a lot about our two twins in what we do at UNICEF, which is humanitarian and development. Yes. As you know, we live in a polycrisis world. Every day you hear about war, you hear about, climate change and, some new crisis that explodes out there in the world. And we have to respond to those emergencies. Yes. But in an ideal world, we would have more funds for development. That's education, livelihoods, health, governance, and sustainable systems. Yes. In today's world, I think we do our best to do both, both in a good measure. Yes. Thinking about creating lasting change, I think that's something that Rotary knows well, because you invest not only in the Peace Fellowship, but in other different scholarships and in the polio program and in so many other initiatives that require community. Yes, I think that's the best that Rotary has. You're unbeatable in your communities and in your networks. Yes. And I think that's my thought, really, creating lasting change. How do you really do it? By continuing to invest in the peace program, as you've been doing, yes, and in the polio program that you do so well, yes. I want to end my talk. Maybe I took a couple of minutes more, um, thinking about the children that we support. If I am where I am today, as working as the chief of staff of the Community of National Committees, it's because one day Rotary invested in me, and it'll open doors. I remember back then when I was in North Carolina, it felt like nothing was impossible. The sky was the limit. If we dreamt about it, Rotary would make it happen. And you really did make it happen for me. So my hope is that one day one of these children that I help or that we help at UNICEF will be taking my seat here, and that's all because of you. Yes. So I want to thank you for your time. Thank you for your efforts, and thank you for your commitment to peace. And maybe I should pass back to Bernie or Stephen.
Thank you, Karina.
Mhm.
Appreciate your talk. We have a couple of questions for you.
Mhm.
Um, what are your goals as a member of the board of the Duke UNC Rotary Peace Center?
Yeah, it. I'm so proud to be on the board of the Peace Center that once that once welcomed me as a student. Um, you see, and I want to give back. That's what I want to do. I want to give back. One of the ways that I've been trying to give back is by making the Peace Fellows' lives a little bit easier by trying to help them with taxes. I know it's not one of the most popular subjects, but when I was there as a student, filling those tax forms and understanding what they meant, not only federal but state taxes, it was quite daunting. Yes, so I've been trying to help them with that.
Great. And another one, can you share some of the projects you've been working on as chief of staff at UNICEF?
Absolutely. I saw in today's program that we're going to be talking about mental health. Yes. And I have to say, mental health is one of the initiatives that we've been leading more prominently these days. Not only something that we want to do for children and for young people, but with them. So we've partnered with the University of Toronto, Monk School of Public Policy. Yes, a group of young children there, and they've been helping us map uh, youth engagement and child engagement practices worldwide, not only at UNICEF national committees, but also in partner organizations in an effort to benchmark. I think this is one of the most exciting projects that we have on our table right now. And I'm looking forward to the results that we can present soon. Thank you,
Thank you,
Stephen.
Karina. Appreciate your spending your time with us and telling us your story.
Thank
For those of you who are not aware, the Duke UNC Peace Center has a program every year in April, and this year it's on Saturday, April 11th. The Peace uh, uh, Center graduates will be presenting about what they've been doing the last 2 years, and it's amazing what they do. So look that up. You can and see about registering and attending. And now Jim Mortimer will tell his story about why he and his wife have become members of the Rotary Foundation's Legacy Society. Jim, you're up.
I'm up now. Okay. Karina, thank you very much. I appreciated your overview. And also thank you for inviting me here today.
Hi, Bernie.
Yeah, thank you. I've been a member of McMurray Rotary for 20 years, and I joined Rotary for the same reason that I think a lot of people join Rotary, to give back and to make a difference. I've been president 2 times of the McMurray Rotary Club. I serve as the philanthropy chairperson, and I've been a board member for 15 years. During the last 16 years, I got to tell you, I barely really understood the full meaning and impact of the Rotary Foundation. And I started getting more involved in understanding it the philanthropy group of district grants and world grants in my role as philanthropy chair. And I also became a member of the Polio Plus Society. I then could see all the good that Rotary is doing all over the world and the support that was needed. And so I'd like to hit pause for just a second. You know, being in Rotary that long and not blowing my own horn, but I was CEO of a, medium-sized company, and I still really did not understand what the Rotary Foundation is and what can do. And so I'd like to make a suggestion anyway to the group, and that is I think we need to make it more understandable for other Rotarians exactly what the foundation does and how we can contribute. Because once you get it, you get it. And it's sort of like algebra. You know, it seems really confusing for a while, but once it hits home to you, it can be a good feeling. So just my input as a takeaway that I would suggest that we just make it a lot more simple about what the Rotary Foundation does and how to get involved. In any event, my wife, Dawn, you can see her here in the picture. We're at a restaurant in Pittsburgh and celebrating something last year. And we knew that we needed to complete our will. And like a lot of people, you kind of sort of put it off and it doesn't come up to the top of your list. And, we needed to get it done. And then in the fall of 2024, Tyler Stokesbury, who's the major gifts officer for Rotary, came and visited our club and gave a great talk about the Rotary Foundation. Now, I got to tell you, this is not the first talk we've had about the Rotary Foundation. Al DeLucia, Tony Zalagua, and others do a great job getting this message. And for some reason, at that meeting, it hit home for me. And also Al DeLucia put together the $1 Million Dinner Initiative for the Rotary Foundation. And then everything just sort of clicked for me and my wife, Dawn, about what we wanted to do. Al came over to our house and helped us fill out some paperwork and really helped finish our estate plan. I will tell you that we don't have any children. We have very limited family members. And we wanted the majority of our estate to go to a cause that was well managed, sustaining service projects that changed lives here and around the world. Now, having said that, we did look into other charities, and there's a number of them that are very, very high rated. I'll just throw out one, St. Jude Children's Hospital. I know them very well. They're a customer of ours and one that I deal with, and others that tend to focus on medical issues, and they're all great. But they're limited in their scope as far as that specific thing that they do. So we looked at, again, Rotary Foundation that receives a high rating of the Charity Navigator for 17 consecutive years. And the Rotary Foundation supports sustainable, high-impact humanitarian projects worldwide, with nearly 90% of the funds going directly to disease preventions, namely polio, clean water, education, and peace building. So we looked at the Rotary Foundation as something more global. So not that there's anything wrong with these other charities, but this Rotary Foundation touches many areas. So we decided that the majority of our estate is going to the following endowments: the World Fund, which the funds are directed towards district designated funds, disease prevention, water, sanitation and hygiene, education and literacy. And the reason we chose those is because they touch many aspects of our society. And they help create an environment of peace, fighting disease, providing clean water, sanitation, and improving health of mothers and children, supporting education, and growing local economies that directly build optimal conditions for peaceful societies. So when you put all that together, I've always looked at Rotary as a means of providing hopefully global peace. Not that we're trying to end wars or whatever, but when we understand various societies and what they do and how we can help them with education, clean water, medical needs, education, et cetera, it just grows it. So after we pass, our gift to Rotary will be with our original intention to give back and to make a difference. And we think that our gift to the Rotary Foundation checks all the boxes. We're very happy to do so. And it's really the one thing that we want to do. So I'm not sure that's what you wanted to hear, but that's kind of our story. And certainly I'd be delighted to answer any questions.
Thank you, Jim. That was an interesting talk. Um, I've met a lot of Rotarians that they've been Rotarians for a long time, and they never paid much attention to our Rotary Foundation. And your story hits the spot. How do you have time for some questions?
Absolutely. I do have another meeting I've got to go to, but I've got 10 more minutes, so I'm good.
Okay. Um, how do you think you can cause, or we can cause more Rotarians to support the Rotary Foundation?
Absolutely. And I've given a lot of thought to that. And, you know, for the benefit of this group, I'm involved with a lot of biotech research projects. And the problem is when you're looking at people trying to support that, it's sometimes difficult for people to understand it because we get too much in the weeds of the science and the words and all this kind of stuff. And you got to break it down so that people really understand it. And so, in my opinion, to get more people involved is to make it simple. You know,
Okay.
don't go into all the details of how much money, where it's going, and the specific growth projects, et cetera. Make it like really, really simple that if you give this money, this is what it's going to do. This money comes back to your club, to your district, and this is what helps fund the projects that you're interested in. Number two, and correct me if I'm wrong on this, but I think I got this right, that the money that is donated, there's always some Rotary Club that's involved with trying to make it happen. So it's not like it just goes in this big fund and some guru is deciding where it goes. There's always a Rotary Club that's initiating what's going on. And to me, that gives me the trust that I know that people are responsible for making these funds go to a great cause. Hopefully I got that right. Correct me if I'm wrong, but that's one of the things that's important. So my takeaway is don't do one message every year or every 6 months. Keep talking about it at your Rotary meetings, but keep it simple and show where the money goes. If you invest this in this charity, this is how the whole process works. And keep it to, you know, I'm a simple guy. I'd say keep it to 3 bullet points and people will get it. It took me 16 years to get it. And I've been actively involved. So that's my takeaway, if for what that's worth.
Okay, thank you, Jim. That's a great story. I think we can take your suggestions to heart. Uh, I I agree with what you're saying. Um, any final comments? We know you mentioned some other uh, large charitable organizations. Was there anything else you can add about why you support the foundation over the others?
You bet. And you know, my wife and I gave a lot of thought to this, and in planning our estate, we said that, as I mentioned earlier, that we don't have any children, and we do have other family members, nieces and nephews, etc. But they're doing fine. And the whole reason about being in Rotary was to help people globally, and to make things happen. And so, yes, we looked at a lot of other very good charities that are very well run, etc. But again, their focus is fairly narrow, and that's okay. That's their focus, that's their purpose. And again, I threw out St. Jude, a wonderful organization. I know many of the scientists on a personal note, but that's really their niche. That's their focus. And I think that's fantastic. But through the Rotary Foundation and the areas that we chose to focus on, as I said, water, literacy, education, et cetera, to my wife and I, we looked at that as really more of a global area. If we help those people succeed, that should help promote really a more peaceful society. Again, not that we're trying to end wars, that's not what Rotary is really about. But if people are self sustaining, they've got clean water, they've got hygiene, their kids are being educated, et cetera, they should be promoting a peaceful environment. And that's really what we want to see is how do we promote peace globally? And if our gift can do that through the Rotary Foundation and the areas that we checked off, that's all we want.
Okay, thank you, Jim. We have one quick question from our audience. Should Rotary Foundation education be included in new member orientation?
Absolutely. And that's something that I think is vitally important. We're all looking at bringing new members into Rotary, and there's potential Rotarians all over the place. People that really want to do good, they want to give back, they want to make a difference, etc. So we try to get them into our club. But part of that, I think we need to do is get them involved and get them initiated into some of the things that, Rotary globally does. Yeah. And we need to, again, I'm repeating myself, but we need to make that a simple message about how their contribution in whatever that is, whether it's $20 or $20,000, that they will help make a difference. And so that should be in the indoctrination of everybody that joins Rotary. And even people that have been Rotarians for years, unless we keep the message out there, people forget. And if you think about, just throw it out, if you think about religion, we keep sort of saying the message a lot. And if we don't, then people forget and they move on. And that's what I think we need to do is we've got a powerful, great message of the things that are being done. And even though some of the things we do in the Rotary Foundation is not necessarily in our backyard, it's important. We should, when we come to a Rotary meeting, we should forget about, politics and forget about race and forget about all of those prejudices and focus on humanitarian efforts, which makes Rotary great. And that's really what we wanted to do.
Great. Thank you, Jim. Thanks for sharing your story and your thoughts. Many of us are thinking about how we can do more to support our Rotary Foundation. And next we have Dr. Geetha Jayaram, Assistant Regional Rotary Foundation Coordinator, who will tell us about some of her experiences with global grants. Geetha.
Yes. Good evening, everybody. You're all here because you're hardwired to help others. And I'll tell you, as somebody who has worked in the neurosciences, every single one of you, if given a chance, would help someone without pause. you've seen these reports on the national news. Sometimes it's children who go out and help someone who's a total stranger. So I want you to keep that in mind. Every one of us is hardwired to help others. Rotarians in particular are aware of this. When we look at global grants, since the foundation was established, we have had Rotary Foundation introducing global grants in the 2013-14 year to fund large-scale sustainable activities that are aligned with one or more areas of Rotary's areas of focus. Now, prior to that, and I can tell you this because I've lived long enough in Rotary to experience it, there used to be what are called Carl P. Miller Discovery Grants. There used to be University Teachers Grants. There used to be matching grants. I've done all of them. They were smaller scale grants and very finite, limited amounts given to activities for a particular purpose. But Rotary figured out that if you wanted to engage more people, increase your impact, extend your reach, you needed to give a larger amount for a very clear cause that supports one of our areas of focus. Now, one of the objectives today is for you to understand how much Rotary can do on a large scale. Now, I cannot begin to tell you how pleased I was to see this article in today's Rotary, in this month's Rotary magazine. I'll show it to you. It says, "A phone call away about mental health care in Lithuania." In 2015, I spoke at Sao Paulo, Brazil. And Karina, you will be pleased to hear this. I was given a Rotary Award. At that meeting, many people came up to me to say, how can you come and help us in our country? So Vygintas Grinis, a past district governor in Lithuania, came to me and said, can you help us establish a mental health plan for rescuing our young people who were between the ages of 15 and 24 because they were dying by suicide to a degree that was 6 times that of the US population. So we launched a program of trying to figure out how we would replicate what we had done in India 30 years ago to something in Lithuania. And you will see you should read the article to know what an impact it has had. So we worked with stakeholders in the community. I toured Lithuania more than once with Rotarians there. They were an extraordinary group who were focused on mental health, disease prevention. All of the stakeholders in the community were law enforcement officers, mayors of towns, the Vilnius University School of Public Health, which is the oldest in Europe. I worked with the dean of that public health school. There were caretakers in the community, family members. It was an extraordinary cohesive effort in Lithuania. So we trained people to screen for and identify common mental disorders, something that I had accomplished in India, and that program is still going. It's close to 27 years now since we established it. So here, what you see is that the train the trainer method, or incorporating the help that these young people needed in the community, spread so remarkably that these Rotarians, with the help of some other people around them in terms of other countries, and one global grant, which we wrote in 2018, have managed to train, listen to this, 10,000 people in the community to identify and look for ways to prevent suicide. We established 3 suicide prevention hotlines then, but what has spread in the country now since 2018 is more and more people have been trained and have helped people to, listen to this, to reduce suicide rates by 55%. Where can you see that happen? I have not heard of a school of public health, an academic institution, or any other institution other than Rotary accomplish something like this through one single global grant. So what makes a great global grant? You have to be able to have a very nicely done needs assessment. Now, details are all there on the Rotary website, so I don't need to talk to you about that. But that needs assessment must involve the input and guidance of the local community using their strengths. So you can't go in with a prescription for what they should be doing, but you should be encouraging them to tell you what works for them. The right goal must be aligned with the right area of focus. I've seen many global grants turned down because they don't align with an area of focus. There are many ineligible expenses that really don't contribute to the health of the community, and those are not going to be approved. And usually people come to me with, how do I work with a partner for our project? And now Rotary has made it so easy because you have a list of all of the projects that are underway on the Rotary website. Look at the Rotary showcase, ask the cadre of technical advisors or the grants advisor for your region or your target region, and they will be absolutely delighted to help you. So will other successful grantees. Now look at the new Rotary Project Center for Partners, where they're actually actively looking for someone to join hands with them. So you can post your own projects, you can look for similar goals among partners and join hands to make a bigger impact and expand your reach and scale up your work. Now, other tips for a global grant application is you must absolutely build a relationship with the local Rotarians and participating recipients, because without that, your grant, no matter how big it is, it will not work. So that is the first thing you do when you go for a needs assessment. Go and visit the place where you're going to send the grant money, because without that, you really fail to see a number of things that could be obstacles in your way to accomplish something. Do your proposed project on a small scale, if you can, in your own district. See what troubles you have with completing that work. And that will fix what you need to do for the global grant application. And there is a very nice guide to conducting community assessments on the Rotary website. And there is a clear guide to global grants that spells it all out. And frankly, just like our previous speaker said, Jim said, we need to read it, reread it, and learn from it, because there's a lot to know and you can't absorb it all in one reading. So I would encourage you to do that. Now, this slide, and if you could enlarge this one slide, please, whoever's running the slide. Bernie, could you just make this this one, could you enlarge it so people can take a look?
This is the best I can do.
Oh, okay.
Sorry.
So, all right. So this little comic strip was for you all to kind of take a look to see what might be, if you go to the slideshow, like the little screen on the top of your computer, that will enlarge that, and then you won't need the next slide next to it.
I'm sorry, Geetha.
All right. Okay. You
I'm
see
sorry.
this screen here where you put the arrow, the one next to it, that's the screen. You don't want half the screen, you want the full screen. Anyway, I thought I would like to show you this, because take a look at it, and I want you all to give me some feedback on what you think are the issues here with our mental health project in rural southern India. What the red dots represent things you can talk about. Take a look at it and give it a few minutes. Anyone? In the very first, the top section, Do you see what the issues are? What do you see there? Anything that comes to your mind. If you visited there, you would see this. Nobody?
Stigma and misconceptions.
Yeah, there you are. So, for a lot of projects, not just mental health, many other projects that have to do with all our Rotary areas of focus, stigma, misconceptions can happen in any place around the world, in any area where there is no ready access to care or support or financing. And that might be the very first step you have to take into consideration. What else do you see here? This little map, what does it show?
Somebody in the chat put obstacles.
Yeah, but what does it show over here in this area with the little map? And you're going to see this no matter where you go to work with your Rotary grant, and that is you are going typically into a poverty-ridden area, into an area which does not have access to care or access to support, access to running water, access to literacy. So access is a big issue no matter which grant you're working on. And transportation and distance from any place where you can access help is a major issue. So these are called, for those of us in the health field, like Anne will tell you, that the social determinants of care are a big issue in any area of the world, west, east, south, no matter where, because those areas in need really have difficulty with anything related to poverty. So you don't have transportation, you don't have enough money to pay for your medications or for immunizations or for any number of things. You do not have enough money for proper nutrition or to pay for schooling. So those are basic concepts that apply to any global grant where you want to make a difference. And what's the second panel here, do you think? These ladies here, what's the second panel?
I think people have come to help.
Yeah. So
But
these
the question
ladies,
is whether they're going to just tell the person what they need or whether they are going to try to engage in a relationship and learn from them what they perceive their needs to be.
yeah, it's the latter. And these women, you don't see their badges, but they are called community-based health workers. And you will see them in many countries in Africa. You will see them in South Asia. You will see them in many other parts of the world. And in fact, our polio workers are community-based health workers who relate to people in the community by physically going to where they are, rather than expecting them to bring their children to a clinic. So this is a concept that's worked very well for Rotary. And now in the Western world, we're realizing now, 30 years later, when this has all been executed by Rotary and many other organizations that understand the local cultures, that we save a lot of money by preventing rehospitalization, extensive treatment, emergency room visits, if you reach out to the people in the community. So now, guess what? MedStar and Kaiser Permanente and large hospitals like Hopkins have a community-based intervention. So Rotary was way ahead of these institutions, is what I'm trying to tell you. Now here, this third panel, what does it show here? I mean, this woman has a megaphone and there are people sitting here. What's all this about? Take a guess. It's
I
not
see
true.
misunderstandings.
Yeah.
Mental
So
health. She's saying mental health is not caused by spicy foods or whatever else it is that people imagine. Yeah.
So what we are saying is that understanding the mental health issues, these are focus groups or village discussions where people sit around and discuss what's going on in this little group sitting on the ground. The other is education about misconceptions, education about the health initiatives, education about water and sanitation. Even wherever there are barriers, there is a lot of education needing to be done. And like Carolyn said, communication. We need to communicate what we think might be helpful to them, but we also need to receive communication from the recipients of care, okay? Now, what's this last panel here? What's the little bit here where all of these caseworkers are standing together?
I think one of the things I've seen throughout all of the panels is that sometimes when we look at global grants and all that we think of it being too complicated and that it has to be so involved in such a 5,000-foot view of what is going on, and it could be as simple as spreading the message through the village of just that mental health is not that you doing this, but that is
absolutely,
and then at the bottom is just showing that sometimes you just need to be present, present to show people that you care.
Yep. Absolutely, you're right on the money. So in African countries, they have something called the friendship bench, where there's a bench where villagers can go sit down and wait for someone else to come and listen to anything they want to talk about. Believe it or not, this is widespread studies done in these countries where they've documented a remarkable difference that has made in the local villages to destigmatize, this is particularly for mental health, destigmatize mental health issues, but also offer a shoulder to someone for support where they could readily access it and not feel embarrassed that they're going to a hospital or a clinic where they would otherwise be identifiable. Now, here, one of the things we've noticed is that in every place, I've worked now in 4 continents, every place where I have worked, the workers themselves experience this sense of pride, this sense of being delighted that their work is meaningful and has made a difference. And they all have this little piece of awe. And that's the last point I would leave you on. And that is, when you see a child seeing a double rainbow in the sky, when you first go and see how big the Grand Canyon is, you have a sense that you are a minuscule particle in this universe where extraordinary things can happen. You see that awe in the eyes of these caseworkers. You see the sense of wonderment that a child has when it sees a butterfly or a crawling insect or a flower. And that is something Rotary gives you that you can't get from any other source. I will tell you that. I go into a village and this elderly woman who's in her middle 80s comes to see me in the village in southern India. And because I've been going every year for almost 50 years, they know who I am. And I say, why did you walk 10 miles to come here? And this lady says to me, doctor, you have come from 10,000 miles away. What is 10 miles? She says. So understand that Rotary can make an extraordinary impact, not just on the people you're giving the help to, but on you. And I will leave you with that little piece of awe. And you should read the article in the Rotary magazine about Lithuanians making an extraordinary difference for the whole country, not 1 or 2 villages, 1 or 2 towns, the entire country. That is the magic of Rotary. Thank you.
Thank you, Geetha. Incredible talk, very insightful. We're kind of running short on time, so I'll just ask you one question. What does a global grant do for you? How would you benefit how would we benefit the people on this call?
I think I already explained that,
I
Steve.
think you did. I think you did. So Lloyd can't be with us tonight. Anne, do you have you want to take 2 minutes?
Come off mute here. I'm happy to. A little background is I came into Rotary in 2009. I went to Southern Sudan to help a dear friend with a medical project there. The following year, I did consulting with the Ministry of Health on maternal mortality. and a couple of other projects. And that year, a friend of mine came to help, and he had started what was Stop Hunger Now and then became Rise Against Hunger, and I became the country director for them. But what really happened, I had a bracelet on that said, make a difference. And when I got to Southern Sudan, we were working in a remote village, sleeping in a tent, trying to avoid the pit vipers, cobras, and black mambas, and the bats and the rats that were in the building that we cooked and ate from. And everywhere I looked was an opportunity to make a difference. And then my friend said, Anne, we don't have a school. Get us a school, as if I knew how to do that. But I didn't know that I didn't know how to do it. So I thought, well, I might as well try. And it opened with 1,300 students. Um, I put up a couple of metal pole, metal roof structures and hoped some big NGO would come around and wrap them and make a real school building. They never did. So I figured at some point I needed to do that too. These guys that came, and I learned that they were Rotarians. And at that time we were living in Western Alaska. Then we moved back down to the Durham, North Carolina area. And I met a Rotarian at an arts festival 10 years ago. And we started talking about Rotary, and she said, well, you should join. And I went over and joined, and I said, but I'm really interested in international work. Great, join our grants committee. And I wrote several district grants, and it was really satisfying to write a grant and have it funded, not only for my friend's international project, but also for local projects. And then in 2017, I went to my first international conference and was totally blown out of the water when I saw all of these organizations. This was in Atlanta. And so it was very well attended. And I just had no idea that Rotary was so big, that there were so many people from so many countries. And I think it was the following year. Since then, I've been to every international convention that was held, not the ones that weren't held. But pretty quickly, I ended up on the board of the Healthcare Professionals Fellowship, and then became the co-vice chair of the Healthcare Fellowships. And now I'm busy restarting the Blindness Prevention Rotary Action Group. I realized in my work with my friend Jill's project in Southern Sudan that none of these things that make a difference are done without resources. It takes money. And I thought in Rotary, and it was about 5 years ago, I think, that I decided that I wanted to be part of the Arch Clump Society, not for prestige, but because I wanted to meet, I wanted to be in partnership with people in Rotary that were serious about making a difference in the world, that were so serious that they were willing to put their money into the Legacy Society, into the AKS Society now. And I guess I like seeing things accomplished. And by doing it now, I get to work with that. I get to help be sure that this goes in places that I want to see it have. I guess the story in the end that I'll close with is I learned in my work in Rotary that Rotary is the engine, and that all of us have a vision, we have the passion, we really have the wheel. It works from the bottom down, not the top down, bottom up, not the top down, but it is the foundation, that makes the fuel, that makes our passion and our visions become a reality. And as Geetha knows, when we do things that make a difference in the world, we benefit. We help ourselves. We glow from the inside to see that other people are made better. And I'm selfish about this because whenever I speak, I say, here's my bias. Everybody has a bias, and here's mine. See this photograph of my 2 grandchildren? I believe they deserve a better world than we have right now. And I believe your children do too. I believe that every child, every person in this world, we are connected. We are one human body. Everyone deserves a better world than we have now. Let's not take our money with us. Help our children now when they need it, and the rest of it needs to be going to help the greater humanity. Thank you so much.
Thank you, Ann. Thank you for all you do for Rotary in the world. There's a great story about you in the Rotary magazine last year. So I want to just take a minute, introduce Lori Menzel as our Major Gifts Officer, and Katie Leisner, our Annual Giving Officer, are on the call. If you guys can just say hello and wave, and people can see you in see your picture.
Hello.
Okay, thank you. And then I guess it's time to wrap up. We only have a couple of minutes left. We now have, I just want to make a couple announcements. The Zone 33 District Team Learning Program will take place in Richmond on May 1st and 2nd. Registration is now open on DACDB. There will be valuable informative seminars and workshops for district leaders in addition to the governor's chain. DRFCs are encouraged to invite members of their team to attend. This will be a fun experience, and you'll meet and share with your counterparts in other districts. Next slide. And our keynote speakers at the learning seminar will be Rotary Foundation Vice Chair and Trustee Greg Pod and our Zone 33 Director-elect Marshall Butler. You'll enjoy getting to know both Greg and Marshall as they are warm and approachable Rotary leaders. Bernie, do you have any other questions for the audience or from the audience, or do you have time for questions? So next month's program is about the Foundation Zoom will be on Wednesday, March 4th. Will be about our Rotary Foundation Endowment. Joint Endowment and Major Gifts Advisor Beth Trotter and our Major Gifts Officers Lori Menzel, John Teich, and Tyler Stokesbury as they show us how to promote major gifts and legacy gifts to our foundation. That concludes tonight's program. Thank you for joining us this evening. Have a great evening.